do you have hormone imbalance? Do you have estrogen excess or estrogen dominance? Today on the podcast, we're diving into the sex hormones of estrogen and progesterone and what it really means if you have hormone imbalance. What are the signs and what you should be looking for? Again, we're diving into our series on what we should learn about our hormones, our bodies, our periods back in school. So don't worry if you're in your 40s and you're just learning this now. Now is the time.
Welcome to She's Healthy, a podcast for ambitious women on their journey to become the healthiest version of themselves. I'm your host, Lori Aikman.
Welcome back to the She's Healthy podcast. If this is your first time watching or listening, my name is Lori Aikman. I am a nurse practitioner in the state of Florida. I have a concierge functional medicine practice. And before I dive in, this podcast is for informational purposes only. I do have to give you my medical disclaimer. Please take everything that we teach here on the podcast, take that knowledge and then bring it to your doctor, your practitioner, your provider before you make any changes to your health plan. This is not direct medical advice. All right. So again, if this is your first time listening, we did an episode last week where we're talking about normal cycles. What even is normal when it comes to your period, things like that. So I thought I'd dive in and talk about, when we talk about a menstrual cycle, right? There's all these hormones that are going to fluctuate throughout the month, and we can have these hormonal symptoms throughout the month, right? PMS and heavy periods and things like that. And I think a lot of us do know is we can have hormone imbalance. There can be a problem with our hormones that shows up in problems with our periods. And it can get worse as we're getting older. I will give a caveat here. Today, I'm talking to women that are probably still cycling. So you could be a younger woman, but the majority of the women are kind of maybe starting to fall in that perimenopausal range, right? You might be 35 up to like 45. We will talk about menopause on some other episodes. So if you are postmenopausal, stay tuned for another episode where we talk about those things. But we talked about last week on the podcast, again, how we have these fluctuations in the hormones. And the two hormones that come into play a lot during our cycle are estrogen and progesterone. And we actually have to have this balance of estrogen and progesterone. And when those hormones are out of balance is what actually is happening when we have hormone imbalance. That's where that term comes from. It's because we actually want these hormones to balance each other out, right? I've heard it described as their yin and yang or yin and yang, I think is how it's correctly pronounced. We should have kind of equal parts of estrogen and progesterone. And when those are unequal is when we start to see some of these hormonal symptoms. So today we're going to focus in on estrogen. So estrogen, what the heck? Okay, you've heard of estrogen, but what exactly does it do? Do we need it? Why is it important? Things like that. So estrogen is one of our sex hormones, right? We actually have multiple types of estrogen. Three of the main types are estrone, estriol, and then estradiol. And it's the estradiol that mainly comes from the ovary that's going to contribute to a lot of the symptoms that we have during our cycle. So estrogen is actually going to fluctuate throughout our cycle. So if you watched the last episode, I actually showed you, if you even just Google a hormone chart, it's going to give you, a lot of times it's broken down into these different things, what's going on with the uterus, what's going on with your pituitary hormones, what's going on with your ovary hormones, and then how those hormones fluctuate through the month. So estrogen and progesterone are those two hormones that come from the ovaries. And the estrogen in particular, when we start our period, that's the beginning of our cycle, and estrogen is actually low during our period. The lowest point of estrogen is usually about day 3 of our period. And then as we finish our period, before we ovulate, we get this bump in estrogen. It comes back down at the time of ovulation. And then as we move into what's called our luteal phase, so this is after we've ovulated, but before we start our period, we get this another rise in estrogen. So there's two, so basically it would look like two mountains, right, throughout the month. is when we have our two big rises in estrogen, what estrogen is doing throughout the month. So I always like to keep that visual in mind when I hear women telling me about, oh, I get migraines like twice a month, one before. A lot of times it has to do with estrogen, right? It can be that big drop in estrogen before ovulation, and then that big drop in estrogen before they start their period, triggering migraines. Of course, there's other symptoms that can be going on too. But just for you to kind of have that visual, picturing a timeline of the month, and then you're having 2 times during the month where estrogen is peaking and dropping, peaking and dropping. Okay. So you could start to pay attention to maybe some of the symptoms that you have in your body as a clue of, wow, this might be an estrogen problem. So what does estrogen do, and particularly estradiol? So one of the things that it does from a functional, like, why do we need it standpoint, is that it gets the uterus ready to receive an embryo. What does that mean? It gets, right, for lack of a better term, your baby maker, right? Your uterus. If you were to become pregnant, the embryo grows, the baby grows in your uterus. Well, estrogen, and again, when we look at our reproductive organs from that standpoint of reproduction, if we were to be conceiving, when we have a cycle, right, estrogen is going to cause that uterus to thicken up so that if, again, an embryo were to form, it could implant in the wall of the uterus and attach there and then grow, during pregnancy. So that's what actually is the function there at the uterine level. The other thing that estradiol does is that it creates mucus in the cervix. And basically, I think I read a analogy as this is, again, from a reproductive standpoint, that cervical mucus is like an escalator for sperm, right? So if we are trying to conceive, right, we want good cervical mucus. We want adequate levels of estradiol because it's going to help get that sperm up there where it needs to go to form an embryo. So for those of you that might be considering having a baby, or maybe you're trying to get pregnant right now, you're trying to conceive, those are some things you might want to keep in mind. And then the opposite, if you are not trying to conceive, or you're trying to prevent pregnancy at this time, those are also some key things to know. Also, that kind of shows us how some contraceptives or some birth controls work, is they're working against allowing that uterus to thicken, and they're working against that cervical mucus so that pregnancy does not occur. So some other functions of estrogen is actually a happy hormone. And the thing to think about estrogen is it's a little bit of a Goldilocks situation. We want enough estrogen, but we don't want too much estrogen, right? So we want that like just right amount. But estrogen is actually a happy hormone for us. It stimulates mood. It can stimulate libido by boosting our serotonin and dopamine levels. Those are some of those brain chemicals, neurotransmitters that are involved in mood and motivation. The other thing that estrogen does is it helps make our insulin sensitive. What in the heck does that mean? That means that when we're eating food, when we're eating carbohydrates in particular, when we have sugar in our bloodstream, our cells can use sugar for energy, and insulin, I always describe as the key that unlocks the door of the cell that allows sugar to get in for our body to use it as energy. So estrogen helps to make our insulin work really well. And that's one of the reasons why, if you are a woman that's maybe in perimenopause, nearing menopause, and you're gaining weight, even though you haven't changed anything, that decrease in estrogen as you lead up to menopause is affecting your insulin sensitivity and can be contributing to weight gain. Talking about a lot of things, trying to stay focused here. All right. So again, back to that Goldilocks situation and the hormone imbalance. So we can have estrogen excess. And the reason they call it estrogen excess is because two things can be happening. And if you're watching, if you're listening on podcast platform, I'm holding my hands up. So we want to have, again, that equal parts estrogen and progesterone. So two things can happen for hormone imbalance. One, we can have too much estrogen, our body can make more estrogen than we need. Or the other thing that can happen is we can make not enough progesterone. So either way, we end up with this imbalance where we have excess estrogen. We've got more estrogen than our progesterone can balance out. So this can come from, again, making too much. So if there's too much estrogen, maybe we have good progesterone, but we're still having too much estrogen, there's a couple reasons why. Well, actually, first, let's talk about what that might look like. So if you do have estrogen excess, you can have signs like mood swings, breast tenderness, fibrocystic breasts. You can also have brain fog, irritability, anxiousness. You can have bloating. You can have uterine fibroids, also weight gain around the hips and thighs, low libido, and heavy periods, right, are some signs of estrogen excess. But what causes us to have too much estrogen? There's a couple things that can be at play, and especially when we look at things from a functional perspective. So we can have too much estrogen. We can have actually a genetic predisposition to estrogen excess. When I worked with clients and we're doing genetic testing with my concierge functional medicine clients, when we look at their genetic testing again, some of them can be predisposed to just have more estrogen, right? It's just how their body is made, their DNA, their makeup. And so we have to actually have to work against that to bring their estrogen levels down sometimes. Some other things, though, that can be going on is that we can have another thing is called estrogen toxicity. This is different than the estrogen excess. We can have estrogen toxicity, and what is happening is we have hormones, and then we have hormones like estrogen, and then our body actually has to metabolize those. So basically, our body uses estrogen at the cells, and then that estrogen actually gets removed, and it gets detoxed or removed through our liver, and then out through our poop. Right? So there can be, if there's problems with the detoxification of our liver, that can cause estrogen to build up. And if there's problems with the detoxification of our estrogen when it comes down to the poop level, that has to do with our gut bacteria that can cause estrogen to build up. There's gut bacteria can make something called beta glucuronidase, which is basically an enzyme that I like to describe it to my patients. When our liver detoxes estrogen, it's like it packages it up, it boxes it up, it seals it, in the first phase and then the second phase, and then it's ready to ship out. Well, beta glucuronidase, it's like they went and cut the box back open, and now that estrogen goes back into circulation. So that can drive up estrogen. So this is one reason, or one of the big ways that our gut health can play a role with hormone imbalance. But something else that can be going on is a common thing is alcohol actually drives up estrogen. And we think about it, I just mentioned our estrogen does have to be detoxed through our liver. So alcohol can then impact the detoxification of estrogen through the liver, driving our estrogen levels back up. So this can, especially if you are nearing that perimenopause, menopausal range, or if you're somebody who has estrogen, just higher estrogen levels, unfortunately in this situation, alcohol is not your friend. Alcohol might be making that situation worse and driving up that estrogen even more. So let's talk about then the other side of things is that we can have low progesterone. And I'm going to quickly go over this part in the next episode. I'm going to focus on progesterone, but when we have low progesterone, what we have to know is just that progesterone comes from ovulation. Progesterone comes from when our ovary produces a follicle, which is like a sac that contains an egg. The egg gets released at ovulation, and then that sac becomes something called the corpus luteum. And the corpus luteum is what actually produces progesterone. So when you have, if you're not ovulating, you're not going to make progesterone. And if your ovulation quality, like the quality of your follicles is not good, you can still ovulate, but have low levels of progesterone. So again, in that low level of progesterone, right? If we have estrogen and progesterone imbalance, but then nope, actually have low progesterone levels, that's going to cause those excess estrogen symptoms like we talked about. So let's talk about then the other side of things. We can actually have, again, that Goldilocks situation. We can have excess estrogen, but then we can also have low estrogen. So what are some signs of low estrogen? Now, I'm gonna give you a big clue with this. So when we have low estrogen, that's what's happening when we're going into menopause. So we actually have low levels of progesterone, but then we also have low levels of estrogen. So this is going to be classic like menopausal symptoms that women experience. So things like hot flashes, night sweats, vaginal dryness, which can cause itchiness, discomfort, pain with sex, things like that. You can also, because of its effect on the vagina, you can have problems with leaking urine or getting UTIs more frequently. You can also have issues with low mood. Again, remember estrogen affected our serotonin and dopamine levels. So when that estrogen is really low, we can see a more low mood or depressed mood. And we can also have trouble sleeping, trouble with memory, and then bone density problems. So when might you have low, and the other thing I didn't mention this, we talked about in the last episode is periods, is when you have really low estrogen levels, you can actually have very, very light or infrequent. So if you are only bleeding for like 1 or 2 days, you know, don't even need to use a tampon, like it's super, almost like spotting. You're not sure, did I really have a period? Was it just spotting? This can be low estrogen levels. So again, it's that Goldilocks situation because you do need to have enough depending on your goals. I always recommend that women ovulate if they can because it's best for our bodies hormonally, even if they're not trying to get pregnant. And so you do need to have enough estrogen to ovulate, but you don't want to have, again, too much estrogen. So causes of low estrogen levels are again just that natural progression into perimenopause and menopause where our body is naturally going to decrease in levels of estrogen because our ovaries are no longer producing eggs, that we're no longer ovulating. Okay. But some other times, maybe if you're younger than that, maybe you're only in your 30s, maybe you're in your 20s, some signs or causes of low estrogen are under eating. And I will give you a personal story with this one. In college, I didn't have a period for about a year and a half. And I was young and dumb, and I was like, this is great. I don't have a period. Who cares? Thankfully, my mom was an OBGYN nurse and was like, okay, something's wrong. Let's make sure, you know, something bigger isn't going on here. So I went through all these tests basically to make sure I didn't have like a pituitary mass. I had to have an MRI of my brain. Everything was fine. What was probably going on was I was an athlete in college. I played sports all my life growing up. I played sports year round. And then into college, right? We would weight train. We would have like 3-hour long practices, right? And I think you know, all of us at some point can have some disordered eating. I definitely ate. If anything, I probably worried that I ate too much. But looking back in hindsight and knowing what I know now from a functional perspective and knowing more about nutrition, I was likely under eating for the amount of activity I was doing. Again, I was young. I was exercising at least 3 hours a day, at least 5 days a week, if not six. And so even on our like a light day, right, we would be doing weights. I would often like run after practice and do stupid things like that. But again, it just under eating in relation to how much activity you're doing. So think about that. Maybe if you have a very high activity job where you're on your feet a lot, you're moving, you're a coach, you're an athlete. Maybe you're training a lot. Maybe you do. I've had a handful of clients that have been triathletes, right? Those you do need to eat enough in order to fuel your body for those to not affect your hormones. Okay. The other thing that can be going on is smoking can actually lower levels of estrogen. Chronic stress can lower levels of estrogen. I actually have seen this a lot. And a lot of my clients, when they come on, we're doing the more functional hormone testing. So we're doing these more comprehensive panels. And what I've seen is that chronic stress can make a woman in her 30s look like she's in perimenopause, right? And the reason that is that severe stress on the body affects the brain, right? And the brain, then, the pituitary gland is the one that in your brain that is sending out hormones to tell the ovaries to ovulate. Well, if your body is so stressed, your body is so taxed, that pituitary isn't going to send that signal out. Actually, some other hormones can increase that's going to keep you from ovulating, keep you from producing normal levels of hormones. And so often have seen, even in women that are still having a period, right? They're still bleeding, where they're actually not ovulating and they've got low levels of estrogen, progesterone, and testosterone. You can go back and look at the interview I did with my previous client, Morgan Walker. If I remember, I will put it in the show notes. But I remember she said that before she came to work with me, she had gone to another more functional clinic and they were shocked when they looked at her hormones because she looked like she was in menopause, even though she was in her early 30s at that time. And just knowing how the body works, knowing that that is a possibility, right? We were just able to help her by getting her body to feel like it's safe again, reducing the effect of stress on her body physically, and that she was able to really normalize her cycles within about 3 months. That's usually the expectation that I give my patients and my clients. And the reason is that, again, think about estrogen and progesterone are all coming from the egg, all coming from that follicle. And when we ovulate, and what you have to understand is that the life cycle of a follicle is about 100 days, right? So think 90-day, right? That's about 3 months. So the things that we're going to do now when I start working with a client, maybe we put them on certain supplements and we change their diet, right? That's affecting that follicle that's developing now, but that isn't going to play a role in the cycle till 3 cycles from now, 3 months from now. So typically, if somebody like that comes to me that's not ovulating, right, it takes us usually by about month 3, we can get her ovulating again, or the reverse. If they have very excessive estrogen, it can take us about 3 months, maybe more sometimes, depending on if the gut is playing a role, to get those hormones back in balance. So that's just another point for you too. If you are taking some of these more generic hormone balance supplements out there to try to help with your symptoms, and they're not working as soon as you start taking it, understand that it's affecting what you're taking is affecting your follicle that's going to affect your period 3 months from now. So sometimes you need to stick with it, give it time for you to see that full effect of the supplement or the diet or the seed cycling, whatever you're doing to fix your periods. Okay. So we talked about perimenopause, menopause, undereating, smoking, chronic stress. And then the other one is actually too much soy or other phytoestrogen. So if you are somebody who eats a plant-based diet, you're getting a lot of soy in your diet. Right. You can actually, if it's in large amounts, you can actually lower your levels of estrogen. And again, this is going to be on it's how it affects one person's body and another person's body is going to be different. If somebody's more predisposed to having estrogen excess, they may be able to tolerate higher levels of soy in their diet versus somebody who's not doesn't have more that estrogen excess picture. If they're eating a lot of soy from a plant-based diet, maybe, or soy protein or edamame, whatever you want to eat, right? If you're starting out with normal or lower estrogen levels and they're eating a lot of soy, you can actually drop those estrogen levels down too much. So again, this is like another Goldilocks situation where soy can actually help with these hormone imbalance symptoms if you do have excess estrogen. But if you are somebody who does not have excess estrogen and you're having a lot of soy or phytoestrogens, you can actually lower your estrogen too much. This is why knowing exactly what's going on in your body and where your levels are at can be really, really key and really just dictate your decisions and what you do and how what you're using to treat your body. So some examples. So flavonoids. I hope I don't think I'm saying that correctly. From soy, our phytoestrogens are going to do that. And what these do is they block estrogen's effect. What they're going to do is on the cell receptor, they go and block where estrogen would come. But another one that can do this is it's called lignans from flaxseed. So flaxseed is something that I recommend to a lot of my patients if they have that estrogen excess picture, because it's super great. You can just buy it at the grocery store. You can throw it in a smoothie, things like that. And it is going to help to lower estrogen levels, which is going to be great if you do have that estrogen excess or estrogen dominance, whatever phrase you want to use picture. So quickly, I'm going to talk about testing estrogen just in the blood. Again, stay tuned for more episodes. I am actually going to talk about functional testing of estrogen, what that looks like and how it could benefit you. But if you're going to your doctor, your OBGYN, and you're asking for your estrogen to be tested, there's a few things you need to know. One, estrogen is going to be best tested, again, if you are a premenopausal woman, if you're still having a period, maybe you're in that 30s, 40s age range, or even in your 20s. Estrogen is best going to be tested when it's in that mid-luteal phase. So what that means is this is typically a day 19, 20, or 21 if you have a 28-day cycle. So again, your body's going to ovulate mid-cycle, let's say approximately day 14. Then ovulation rate happens, and remember that estrogen is going to peak, progesterone is also going to peak, and then it's going to drop as you go into, near and go into your period. So that mid-luteal phase in between ovulation and then when you start your period, right, that peak time is the best time to test both progesterone and estrogen. If your doctor is just telling you to go check your labs and not telling you when to test in your cycle, just know you're not going to get accurate information, right? So again, mid-luteal phase collection, just a pro tip, I guess you could call it. Sometimes I have I have two patients right now that haven't gone through menopause, but one had a hysterectomy and one had an ablation. So they don't have periods. So it's hard to tell where they're at in their cycle. So before we test their estrogen and progesterone, I'm actually having them use ovulation test strips. Just the little LH strips. You can buy these at the dollar store. I think I bought a bag of 50. I got one right here. I got a bag of 50 on Amazon for $20 or $15. I was able to use my HSA card. So if you use those, when you have that LH surge, you're going to know that's around the time of ovulation. You're going to probably ovulate within the next 24 hours. Then that mid-luteal collection would be about 5 to 7 days after you ovulate. So if you're DIYing, you're really doing this on your own, those are definitely some key things to pay attention to before you go in and have your blood drawn, or maybe if you're doing saliva or urine test for estrogen, then you're really going to want to have that collected during that mid-luteal phase. And then kind of more normal range for mid-luteal phase for estradiol is going to be between 56 to 214 is picograms. It says PG per ml. So that's what the abbreviation that you would see, or the unit that you would see on your lab tests when you get your results back, right? 56 to 214 picograms per milliliter. Okay. So I want to encourage you, if you are a highly ambitious woman, like the women that we work with in our practice, right? You're kind of done, right? You might be listening to this and you're like, all right, I'm done with the DIY. I just want to actually know what my numbers are. I want to see what's going on with my body and I want to get personalized information. I want to get personalized direction from my body and what my body needs. If that is you, I would encourage you. We're running a promotion through today is September 10th. So we have I'm trying to look at the calendar while I'm talking to you. We have about 2.5 more weeks of this promotion where we're doing a functional hormone check. So this is where you can, an opportunity for you to work with our practice just in a small, short container, allow you to get answers. I talk to so many women. I can't tell you how many women are just getting gaslit by their providers. They can't even get their providers to order testing for them. I've had women, be told there's no comprehensive hormone panel and there's nothing you can do anyways. All we're going to do is put you on the pill. And so their doctors won't even test. Some doctors will order tests, but don't even know they're not getting that mid-luteal phase collection. Or some people are getting, correct testing, but without looking at it from that functional perspective, they're getting told, well, everything's normal, even though they don't feel normal. So if that is you, if those situations, does any of those describe you, I'd invite you to join us for the functional hormone check. This includes a 60-minute initial consultation with myself or one of my team members. It's going to include a comprehensive blood panel. This is the blood panel that we do with all of our patients and clients when they come on, followed by a lab review appointment, a 60-minute lab review appointment. And then we're going to give you a functional hormone evaluation. We're going to give you a functional health evaluation, really, and talk about everything that we're seeing on your labs and what needs to be done to how that plays in with your symptoms, how it's showing up in your body, and then what are the steps you need to do to take to start feeling the way you want to feel, to have more energy, to have less mood swings, to have better periods, to get pregnant, whatever your health goals are. We will help you connect the dots and understand what your body needs in that appointment. So this is a super, super low price for this. It's $597. This is the last time that we will be doing this at that price. In the future, just our consult alone will be $597. So again, with this, you're getting 2 hours with our team and the lab test. So it's a super, super great value. Jump on that offer. We only have a couple more left. And again, we only have about 2.5 weeks left in that promotion. So make sure you get it. If you're watching on YouTube, we will post a link below in the comments. If you are listening on one of the podcast platforms, you can find the link in the show notes. All right. I will see you in the next episode.